Good morning. This is Steve Stites, Chief Medical Officer here at the... Oh, my God, the picture they just put up. Oh, my God. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you, fortunately with distance and without a telephone, from the Dole Simons family studio. Yes, I knew I should have been prepared for that photograph, but it came up, and I just couldn't stop from laughing, because in that picture, we were violating almost every single rule of infection control right there.
You're doing hand hygiene.
Okay, I do have hand hygiene. And look, there's Anthony trying to come over and get me to fix my mic, which he spent an entire year trying to get me to do right.
Anthony looks young, spry there.
You know what this is? This is March 19th, 2020. Look at you laughing at me. Everybody laughs at me. And today is March 19th, 2021. This is our official one-year anniversary of this broadcast, and we are so happy that you're with us for this program. And we're happy that you've been standing by us all this time, asking great questions, and hopefully listening and learning of things around vaccination.
Yeah.
Hawkeye, how are we doing this morning?
We're doing good. I think we are in a race with Hayes to have the quickest to zero for acute infections. We know that in New York, even in these past 6 months, there was a hospital or two that had no acute infections there at some point in time. But our numbers are continuing to be good. We were a little bit worried there. It looked like they were creeping up. Today we have 8 active infections with 3 in the ICU, 1 on a ventilator, and 15 in that recovery period.
That's getting low, 23. I like it.
And Hayes only has 2, and those are 2 acute infections, none in that recovery.
All right. That's great numbers. So, of course, joined, by Dana Hawkinson, our Medical Director of Infection Prevention and Control, and Amanda. Good, welcome back, Amanda Cackler. How are you doing this morning?
Doing well.
Amanda's our Director of Quality and Safety, and we're all a year older today.
Yeah.
Yeah, maybe we've only aged 1 year, maybe a little bit more. So this is our morning to answer your questions. But before we go there, let's first see if there are reporter questions. I think Jill's out there with those reporters.
Hey, good morning.
Sorry,
Jill.
Go ahead.
Hey, Cody.
Hey, guys. Hey, happy anniversary.
Thank you, and thanks for being with us.
Yeah.
Hey, no problem. As we get into a year from where we started, I wondered your thoughts on Missouri opening up for all adults by 4/9. That seemed to be by April 9th. That seemed to be huge news. And Kansas moving ahead with phases 3 and 4 next week. Just your overall thoughts on that.
I think it is all great news, and I think it just reflects the fact there's a whole lot of vaccine that's going to be coming into play, and as that happens, we're all going to get safer, and that is, I agree with you, Cody, that's great news. I'm delighted on the April 9th date. If I could speculate, I bet Kansas won't be too different. I think we're going to get through phase 3 and 4, and pretty soon it's going to be, we're just opening it up because we have so much more vaccine. Team, what do you think? Hawk?
I think vaccinations are important. I believe in England they have shown a significant improvement in their rate of spread of the infection because of their vaccinations. They're doing a little bit different than we are, but I believe Israel's had a significant improvement too.
Yeah, they've really shown a lot of great data. Amanda,
Yeah,
thoughts?
I think the critical element of that is the availability. So now that we've got more vaccine available, let's just get vaccines in arms.
And is there a more perfect microcosm of what it means than the University of Kansas Hospital? How many people are out these days with COVID now, since we've got our employees 85% vaccinated?
Yeah,
Amanda?
I feel like yesterday we talked about the rolling number being 0, which is incredible.
That is incredible. And at one point we were per day acute COVID
in the teens and
20s. Yeah. So I mean, if we've fallen 100% to 0, and if that's what the country can do, if we can achieve 85% of people being vaccinated, you know what? Let's go Royals, here I come.
I do think a key point of that is that when you're vaccinated, you may or may not be showing the symptoms. So what does that impact on testing? And is COVID still out there and we're just not feeling the impact of it because we're not symptomatic?
Yeah, I think the ultimate test of that and the ultimate benchmark of that is going to be the hospitalizations and deaths, because just for the point that you said exactly.
And even if COVID is still out there, which I think it's going to be out there, I think COVID's here for a long time. I think it's going to act like influenza, but we want it to act like influenza and not like SARS-CoV-2, because then it won't have quite the same level of death and tragedy associated with it.
Which I was looking at the COVID deaths in-house today, and we haven't had an inpatient death in over 6 days, which that stretch is great because we were seeing them every single day. So that is a positive sign.
Yeah. And I think it's because we have fewer COVID patients, and I think we're doing better with treatment too. Cody, other questions?
Yeah, just one more from me. CDC is expected, I believe today, to come out with new guidance on schools. I'm curious what you've heard on that. Dr. Anthony Fauci also said during a briefing yesterday that change, expected to go, I believe, from 6 feet to 3 feet, could also have an impact on general social distancing.
Yeah.
You know, you've drilled this into us 6 feet for 365 days now, and I'm curious your thoughts on the overall changes in that regard.
Yeah, you bet. So the World Health Organization has been at 3 feet for a long time. Yeah. So the CDC will be making, I think I'm with you, I think they're going to be making the change around 3 feet. You know, it's what we said. You're building the airplane while you fly it. And I think what Fauci is trying to recognize is that is 6 feet safer? You bet. Is there an economic reality we have to face to keep our country open and keep people employed and having an income? I think that's true, too. And I think, Hawk, I'll turn to you first, but let's both comment. 3 feet is probably okay. 6 feet makes me even feel better because I know the dynamic of it. And when we've been in the freezer before, we watch how far our particles go, our breath cloud goes. But I get what he's trying to do here.
Yeah, I mean, I think it goes back to the true unrelated issues. We know that the World Health Organization, since the beginning, has said 3 feet. The CDC has said 6 feet. Why? Because the World Health Organization does have to cater to the world where it is more difficult to maybe spread out 6 feet in some of those countries and some of those communities. But we also have to remember it's not in a vacuum of 3 feet. I believe it's still in the context of, number one, vaccinations, masking, and things of that nature. So that will help. And it's also in light of the data that shows there is a small percentage of transmission of the virus in the schools when you are doing those other things such as masking as well. And of course, vaccination will help also.
Yeah, I think the context of the activities being performed is also incredibly important. If you're not doing anything of high risk, 3 feet is probably fine. If you're doing something more high risk, the further distance, the better.
And we have good evidence. If we kind of go back to one of those seminal papers about transmission and masking with the hairdressers in Springfield, and of the 114 patients, clients that they were able to interview afterward, they didn't find any transmission in those patients from 2 hairdressers that had it. So
we know masking works, Amanda. How many of our employees have gotten sick while taking care of COVID patients?
We have had not any.
I mean, masking works. The evidence is incontrovertible, and I know that there are still some people out there who want to say that it's not true. You're just wrong. I'm sorry, it's just wrong. The evidence is incontrovertible. If we don't spread it in a hospital, when we had 125 positive COVID patients and a bunch of folks in recovery, if we didn't spread it to our employees then because we all wore masks, you know what? Masking works.
That's right.
Yeah, so other questions? Jill?
Unmuted. I found the mute button.
Oh, you know what, Jill? I've been trying to find that for you for like a year. Just kidding, of course. But we're all enjoying that joke.
I'm going to start with a really hard question then, just for that.
Okay.
Bob wants to know, and you mentioned the Royals, so I think that may be the inspiration. But last year at the beginning of the pandemic, you used to tell us we were only in the bottom of the first inning to give us some perspective of how long a battle we had. What inning do you think we're in today?
Oh, that is a great question. You know, I think about that. I'd like to say we're in extra innings because it's been so long.
Yeah.
And I would have said, if you'd asked me that question last year, if you'd asked me what inning we would have been in by now, I would have said, hey, the game's over. But with the year in, I'm going to say we're in the 5th or 6th inning. And I think because we've lived a lot and we've learned a lot, the variants are concerning. We got to get everybody vaccinated, and then we got to figure out how we manage the chronicity of a little bit of COVID out there. And once we've got that figured out, the game will be over. And I think, but right now, I'd say we're in the 5th or 6th inning. We still got a few more innings to play. But what I'm hoping for is vaccination equals HDH. Who remembers that? Come on. Herrera, Davis. Yeah, and Holland, right? We're the closers. We're going to shut it down. That's what vaccine's going to be. Closers for the Kansas City Royals. We'll shut it down, and then the game will be over. There's my answer. Thoughts?
I think one big factor that we still have some time that we have to anticipate is the pediatric or the kids getting vaccinations and what that's going to look like, and we don't have that information yet. So
Yep.
there is still some distance we have to
Great
go.
point. And Moderna starting their trial on young, and even down to, was it 6 months or 2 months? I don't remember. It's very young.
Yeah, I mean, I'll say middle of the third.
Middle of the third inning?
Whoa.
We got a
Okay,
long way to
can
go.
we mute his mic? Can we mute his mic, please?
We got to
Go
get
ahead.
the vaccine companies to pivot and create some of these vaccines against the variants. Possible multi-strain or multi-variant vaccines. We know we've done that with other vaccines, especially for influenza, which is a good example. We have 4 different strains in that vaccine. So, but hopefully the next few innings will move by quicker and be much nicer.
HDH. That's the new vaccine right there, people. All right, Jill, next question.
Yeah, we have 2 or 3, and I know you have a hard stop today, so we'll rock right through these. I want to ask, this person said, I had my first Moderna on February 3rd. 4 days later, came down with bronchitis and walking pneumonia, lots of meds, and just tapering off steroids. I missed my second dose. Now what are my options?
Oh, that's a great question. I'm not sure that the vaccine causes bronchitis and pneumonia and things like that, Hawkeye. I wonder if there are a couple things going on, but I don't think you want to miss your second dose.
No, I would. I need to see that medical record and details of what exactly was diagnosed and how. But if you missed your second dose, go get your second dose. Again, the guidance is that you can get the vaccine 4 days either side of your scheduled dose. But if you do miss your scheduled dose, go ahead and get that. And there is no catch-up dosing. You don't have to restart the vaccination series. So go ahead and get it, schedule that, and get that second dose.
All right. Another question. I had the Johnson & Johnson vaccine. Next day, I had chills and nausea, and now I have no voice. Is that normal?
I've not heard about the no voice. The other part of man is all pretty normal. Right?
Yeah, those are pretty common symptoms that we've seen with all of the vaccines. The no voice I haven't seen as a specific symptom, but it's not anything that I would be concerned about the effectiveness or anything of the vaccine.
Yeah, no, I would agree. It could just be that a few days earlier you were also infected with another virus. Maybe you got some laryngitis or something of that nature. But
And I would just say, since we don't know all the side effects, it could easily be possible.
Mm-hmm.
But as long as you're getting better, I wouldn't be concerned about it. Your voice is going to come back, and these things, again, we're injecting you with the protein or something that make you start building an immune response to the spike protein of SARS-CoV-2. So you're going to have an immune reaction, and that can manifest itself in different ways, and just as if you had gotten the infection. So don't be surprised if you have symptoms like a little bit of what's been described here, and I think that could even include hoarseness. So I'm not concerned at all. My bet is it's all going to go away shortly.
yeah, remember the Johnson & Johnson vaccine is an adenovirus vector, but when it is injected into you, it does not replicate in your body, so it's not creating more viruses. The only thing you're really getting is the spike protein out of that.
Okay, 2 more, and then we'll start rocking through our other questions. Do we know if any of our patients that are admitted right now have been vaccinated?
That we kind of prepared for that, and we think the answer is no. But we're not for certain.
Yeah, we haven't built that into our medical record yet, so we can't quickly identify that information. I know we've had patients who've had their first vaccine, and they had requested their second vaccine, but at the time that they were here, we weren't able to provide that. I think moving forward, that'll be something that we'll be able to take into consideration, and I know we're working on how do we get that question assessed upon admission.
Yeah, and I would feel, and I've certainly seen a patient in the hospital who got their first vaccine but was in the hospital so they couldn't get their second. They were in the hospital for a completely other reason, not COVID, but I would assume that a lot of patients would offer that information to us. Oh, by the way, I did get my first or my second dose.
Yeah, we've certainly not heard it. I'm going to bet that the answer is no, but I don't know that for certain yet.
Yeah.
So.
Right, and then one more question, and then we'll start on our list. Do we know if the vaccines, all of them or any of them, will help prevent long-haul situations?
Oh, that's a great question. That's a great question. And I'm going to say that because the patients who get COVID with this are often asymptomatic or have very few symptoms, I'm going to bet the answer will be yes. But long haul, there appears to be several forms of it, Hawk, and some people have mild or no symptoms and then develop some long haul things 3 to 6 months later. There's also some discussion that maybe the vaccine helps treat long haul syndrome. So help us out with this question.
Yeah, no, that's weird. The first part is certainly we would hope and assume that because you're not having as critical disease or severe symptoms, that it would help prevent the long haul symptoms later on as well. And there are news reports, and I know it's being investigated fully, what that mechanism would be, but people who do seem to have long haul symptoms seem to have an improvement in those or resolution of those symptoms after the vaccine dose. So that's an interesting thing, and I know that's being studied right now.
Okay, question number 1. If the Johnson & Johnson vaccine ends up being better with 2 doses, should people who only got 1 consider that a setback?
I think that, again, we're building the airplane while we fly it, and we always learn more. So I would never consider it a setback. First of all, you can always go get your second dose, because I think the interval in the study is 3 months, and we're only starting to do Johnson & Johnson now, and we'll get the data in July. So 4 or 5 months, that's not a setback. You can go get the second dose. I would not be concerned about that. Second of all, the vaccine data coming out with Johnson & Johnson is that it's completely protective against being hospitalized or death. So I think what we're going to find out, because there are also ongoing trials with Moderna and Pfizer, I think we're going to find that they have about the same level of single-dose effectiveness. Everything will be more effective with 2 doses, but you get really good efficacy with 1 dose from all the vaccines. I bet that's where we land.
Yeah, and there's information out there even that if you had COVID and then got a first dose of, I believe it was the Pfizer that was published, you have higher antibody levels than if you just had the infection by itself. So that first dose almost acts like a boosting dose as well. Now again, this guidance is still, because those studies were done with 2 doses, mostly to obtain durability and a full protective immunity, but there are studies being done with 1 dose. And that is how England or Britain has gone through their dosing schedule to try and get as many vaccines into arms as possible. They've kind of just elected to go with as many first doses as possible and then come back and get your second dose later.
Yeah, 1 dose is better than no dose.
Yeah.
I heard you say studies suggest the possibility of infecting others with the virus when vaccinated is growing more remote. But is it also true with the variants?
Team, I think we just don't have enough information around this question yet. The closest would be some of the South African data on the J&J, which tend to look pretty darn good. But I don't think we know enough.
We don't know.
Yeah. Mostly the variant information, especially with J&J, is surrounding hospitalization and death, which it does look to have continued efficacy, although not as high from these kind of original Wuhan variant issues, but we hope, and we're extrapolating from the real-world Israeli data and from some of this other Johnson & Johnson FDA brief data, that overall it should help reduce. But we just don't know with the variants. So that is what we are going to be learning, and I think England is going to be a good real-world experience with that because of the prevalence of that UK variant, but we're just kind of waiting and seeing that.
Is it okay to grow my bubble and be unmasked with others if everyone is fully vaccinated? Any limits to the size of those gatherings?
This is a great question. I'll turn to Amanda first. And I think this is going to be another of those, we're building the airplane while we fly at things, and we've learned a lot more about SARS-CoV-2. Now we're learning about the situation that can occur after vaccination. I'm probably more comfortable, but am I comfortable?
Right. I think there are a couple things to take into consideration, and that is, are all of the household members of the people that you're including in your bubble also vaccinated? And I think we need to be really cautious still not to extend, even if you're in a group of 5 or 6 or 7 who are all vaccinated. We know that you can, or the CDC guidance is that you are able to interact without masks, as long as you're not in a healthcare setting. That was very specific in that vaccination guidance. But I think you have to take into consideration who are they going home to, and are they vaccinated, and what are the potential risks there? Again, what are the activities that you're participating in? Are you just having conversations? Are you singing together or eating together or those kinds of things? So I think I'm more comfortable, but I don't know that I feel
comfortable.
Yeah, exactly.
Right. Yeah, that's where I am. What do you think, Hawk?
Yeah, I mean, I think we're getting there, but you have to make sure, just as Amanda said, is everybody in that household that you're meeting with vaccinated? So it's not just the adults going out and meeting with vaccinated adults. I think that's the important thing to remember. And what size? I don't know. 10 is an arbitrary number. That's been said since the beginning. What's the difference really between 5 and 10? Well, then what's the difference between 12 and 15? I think we're still kind of trying to understand all of that.
Yeah, we're early into this. I think we feel more comfortable. I don't know that we feel comfortable. I think the point you've made about who are you going to, if you were to get the virus, who are you going to take it home to or to, and how sick could they be, and how you feel about that? That's the question you have to really answer. And I'd say if you're going to go into a home with people you haven't been around a lot and you're not sure about their behaviors or where they've been coming from, even if vaccinated, we think you can still spread the virus. I'd say still wear a mask, maybe take it off for dinner, try to be apart. And in the next few months, we'll have a lot more information about this question.
Yeah, I mean, there's just so many permutations to this, but we also do understand, like we alluded to in the first question, one of the first questions about, there's more signal that the vaccines do prevent asymptomatic disease to a good extent right now. And if that is, then we are extrapolating, saying, well, then you probably are have less transmission because you have less viral replication. The other thing is, say, for instance, in your households, if all the adults are vaccinated because they are healthcare workers or essential workers, are in those phases and we're able to get it, but the children are not, but the people surrounding that family, the support givers like grandparents and things, maybe they've been vaccinated as well. So that's something to consider also. Those most vulnerable populations, maybe they've been vaccinated at this point. That's just other details to consider.
Jill.
Right. Once my parents and I are fully vaccinated, can I safely give them a good long hug? They are in their 80s. One has COPD and the other has cancer. Masked or unmasked too?
That's a great question. First of all, it's always safer if you do it with a mask on. But I'm feeling better about the good long hug if everybody's vaccinated. What do you think, Hawk?
Yeah, I think so. I think in this situation, yeah, I do.
Yeah, I think we've talked about hugs before. And
I know. I'm the hugger, people. I am
it's
a hugger.
It's good to give hugs.
We've determined that hugs are safe.
Yep.
And especially if all parties are vaccinated, I think, absolutely.
Yeah, I do too.
Just be careful doing that at work.
Yeah, that's right.
Okay,
this is a medical show. We're staying in our lane, people. Although that was pretty funny.
It was. I heard steroids and medications that treat compromised immune systems make the shots less effective. Is that true? Should I stop taking them until fully vaccinated?
Oh, don't stop those things if you've got an autoimmune disease or some process that the steroids and things are helping you control because you don't want to get sick from that. Hawkeye, what do you think? I think depending on what your level of immunosuppression is, we're still seeing that even transplant patients can get some immunity from vaccination.
Yeah, absolutely. I think that's a good question. I think it all depends on the level of immunosuppression. We know that even if you are some of those highly immunosuppressed patients with solid organ transplant or bone marrow transplant, there are regimens and time frames in which you can get your vaccine after those transplants occur. So I think it's important to understand that we do expect that there is some reduction in the immune response, but we don't know fully what that is. And if somebody is prescribing you steroids or other immunosuppression, certainly speak with them. There is some data coming out now. There was a report about transplant patients receiving their vaccines. But again, these are highly suppressed patients on different medications. So certainly talk with your provider. But overall, you are still we're going to give you the vaccine just because the benefit outweighs the risk.
Yeah, don't stop your regular medications.
Right.
Get your vaccine.
Yeah, don't stop your regular
If you're on, just a dose of prednisone or something of that nature, one, maybe two drugs, you're still probably going to mount immune response as well. So.
Yeah, and I mean, transplant patients are often a drug called Prograf, another one called Cellcept, and 10 or 20 milligrams a day of prednisone, and they can still get some recovery or some important results from vaccination. So get vaccinated. Okay.
All right, I'm going to squeeze this one in from Pat because it's kind of along the same theme. His son had brain cancer 4 years ago, and he's on seizure medication. We have a lot of people asking about seizure medication and getting the vaccine. Is it safe?
I think it's safe.
Yes. Yeah.
Amanda?
Yeah, I haven't seen anything to suggest otherwise.
Yep.
Let's go.
Get it.
Get the vaccination.
All right, next question. If I've not had any side effects from the second dose of Pfizer or Moderna, does that mean my shot failed? Shouldn't I feel something?
What do you think, Amanda?
I
Has
think
the shot failed?
It absolutely has not failed. We have seen such a variance in people's response to first and second doses, but it doesn't mean anything about the effectiveness of the vaccine itself. It's just everyone's response is a little different.
That's how I look at it. I think it's absolutely the right thing to do. You're still going to get vaccinated. You're still going to get a response. Some people are like that with influenza vaccine. Some people are like that with the shingles vaccine. I barely had a side effect from the shingles vaccine. I had a terrible time with the Moderna second dose. Not terrible. I just got chills and fevers for a day. But it can happen. But you still are going to offer. You're still going to get that immunity, Hawkeye.
Yeah, I agree. There's no recommendation to check antibody levels or anything like that. And again, there's no commercially available T-cell immune assay either. So, get that vaccine. There is no correlate of protection or no correlation of having bad symptoms after the vaccine doses and having no symptoms after the doses and having protection or not.
Is anyone in the metro doing genomic sequencing to spot more infectious virus variants?
I know that KDHE is doing random sampling throughout the state, and Missouri is doing the same, looking for this. And so I don't know that anybody else in the metro is doing it. They're looking at it both in wastewater and with some of the tests that come to their lab.
Yeah, I don't think that the availability of the tools to do that are beyond KDHE at this point in the state of Kansas.
Yeah, I agree. I mean, we have the ability to send any specific isolates of patients if we think they have been infected before and now are coming back in with a reinfection. We have that ability to send to the state. But just as you said, and Secretary Norman has said, they're looking.
Yeah, and we look, and we've sent some out because we were a little thought, well, that's a little bit of an odd sign. Let's go ahead and send it just to be sure. But so you can absolutely ask the state to do it, but I don't know of anybody else specifically doing this testing
widespread
right now.
Surveillance.
Yeah, there are some. You have to actually have some research equipment that actually you could do in the city. I think hospitals could work with some different places in the city if we really wanted to. But the state's offering it, so I don't know if there's another.
I think there's enough labs around the city to be able to do it if we needed to.
Yeah.
But, yeah.
All right. Next question. Do the current vaccines protect against the South African and Brazilian variants enough to keep one out of the hospital? And what's the big deal with those, including the UK?
Yeah, so Hawkeye, I think the answer to this question is not completely known, but it looks like the J&J data in South Africa demonstrated that it did keep people out of the hospital.
Yeah, we do have kind of real-world trial data with, just as you said, the J&J vaccine, and it did have efficacy. I think it was 65 or 70% against severe disease and death, which is really good.
That was 82%. Maybe I'm wrong.
I hope
I'm right. They get mixed up.
I think there still is good efficacy there.
Yep.
We do have new, I think just this week there were 2 published articles, correspondence in New England Journal of Medicine, both about Moderna and Pfizer, but these were lab studies, so these were looking at just at neutralizing antibody levels against UK and South Africa, and they still, although had reduced antibody levels, did have fairly good levels of antibody against those 2 isolates. And what are the big deals with them? There's certain mutations. There's about probably a 20 or 30 amino acid stretch in that area of the spike that binds to our receptor. And within that, when you have mutations or amino acid substitutions, which just changes how that receptor or that binding domain looks, that is what will block new antibodies that are created by the vaccine. So specifically for the South Africa, the number that you're going to hear is 484. There's an amino acid substitution at that position in the spike protein, and that is what helps reduce the efficiency of the vaccines.
So.
I have nothing to add.
Yeah, I don't have any data either.
They asked.
It's a great. You gave a great and very, very well informed answer. And just to say, that's the second set of animal and lab data that's demonstrated the same thing about Moderna and Pfizer vaccine against the South African UK variant that's been published in the New England Journal of Medicine. There's a correspondence about a month ago that kind of said the same thing, as I recall. So I think that's really good news. It is what it says to us is that it is going to work, and so I think we're pretty comfortable with that. The second thing I would just point out is that as you look across the country, there are variants. These variants are already in the United States, but they've not taken off like they had in other countries. So now they are starting to in some areas, just to be fair. But I think part of what we're seeing is that we have had some success, especially in nursing home vaccinations, where so many people are vaccinated, and we're not seeing a spike in nursing home admissions.
Yeah, I mean, just to your point, too, the California variants, that is another amino acid substitution in that range that I talked about that just changes the way the spike looks. So we are kind of waiting for all of that information. And remember, on the spike protein itself, either from the J&J vaccine or the Moderna Pfizer vaccines, there's about 20 epitopes or 20 regions that we really look to make immune responses against, both with antibodies and T cells as well.
All right, Jill?
Yeah, one more printed question and just two real quick things. I'm watching the clock. Caprell, I hope I'm saying your name right. She just wants to say thank you because she had so much anxiety with this COVID going out in public until she started watching your show, and she just appreciates all that the panelists do to keep them safe. She said her anxiety level went down a lot. So a big thank you.
Well, thank you,
Lori said that North Kansas City schools last night sent the parents notice that they're going to let the kids play on the playground without masks, but they said it's the parents' option. She says, should I keep my 5th grader mask for now or let them go?
What do you think, Amanda?
I think I would recommend wearing a mask.
I would too. I wouldn't hesitate. So wear a mask. There are a lot lower numbers, but let's see how we do when schools are open, bars are opening up, restaurants are opening up, more people are getting vaccinated. Let's just wait a little longer, especially if your child is going to come home to a place where people haven't been vaccinated, or they're going to have sick parents or sick grand or anybody. If they're going to be around other people that are going to be ill that they could potentially make very sick with COVID-19. So I think the risk is not to the child so much, but really the risk is to the home environment or whatever bubble that child travels in. I think that should help guide your decision. I'd wear a mask.
Tammy wants to know if you have any concerns about the big box stores, the pharmacies, groceries, handling the vaccine according to storage, thaw, and administration.
Well, I don't. They handle medicines all the time, Hawkeye.
Yeah. No, I mean, they've been giving vaccines for a long time. So, and I think, again, Johnson & Johnson makes that a lot easier to do.
But I don't have a concern. Pharmacies handle medications all the time. They're experts at it,
That's
so I think
exactly
they're very
right.
good.
They're still professionals. They know what they're doing.
Yep.
Makes it easier for the community to access it.
And the last question of the day is a popular one. Allergy season seems early. If I had a cough, a runny nose, or a cold, symptoms, can I still go get my shot?
So yeah, you can still get your shot. I would almost wonder if it's necessary for you to also get your test done.
Yeah.
Yeah, get your COVID check before you get the shot.
Yeah, I would agree. I
both.
think, get to a PCR antigen test if you're having symptoms. If that's negative, then go ahead and get it. We give vaccines regularly to patients in the hospital. Obviously not COVID because we aren't giving those to our hospitalized patients, but patients who are in the hospital and ill for other reasons. I think as long as you are 24 hours out or more from a fever, I think you're okay to go ahead and get those vaccines.
Just to say, the other remarkable thing about this point around masking, I'm going to make it again because it is incontrovertible. We do these respiratory viral panels a lot in the hospital when there's a set of like 22 viruses we check for. It includes coronavirus, now not SARS-CoV-2, but coronavirus in general. And in my population of cystic fibrosis patients, is a pretty routine test. And so I am not seeing positive RVPs. You know what? I'm just not seeing coronavirus on those tests. And coronavirus kind of acts like coronavirus, and it responds to masking, because we've known that in the hospital. So I think even the lack of influenza, the lack of RSV, the lack of other coronaviruses, the lack of all these viral illnesses coming in and people being tipped over from their COPD or their asthma or their heart failure, chronic disease by these viruses, the lack of seeing that is testimony to the effectiveness of masking.
Well, I think to your point, to the bone marrow transplant patients I see, which again are probably some of the most immune suppressed patients you will ever see. They have absolutely no white blood cell counts to fight off infection. Your colleagues happily perform bronchoscopy, so they go down and look at the lung, wash out the lung. We haven't found really many other viral infections even going down looking in the lung for people who have known lung infections. So I think that's just continued, testimony and support.
And I don't think that it's realistic, but I think it's an extremely important infection prevention pillar. Wearing the masking really does prevent the spread of transmission of really everything. And supporting good hand hygiene in the playground setting. I mean, you're touching a lot of surfaces, not specific to prevent COVID-19, but other organisms that are running around on surfaces. So I don't know how realistic it is to have kids running around with hand sanitizer or to wear masks forever. I'm not suggesting that, but it is good preventative practices that we've known about for years.
Hey, Monday we will update COVID-19 vaccine and outpatient therapeutic trials. There are opportunities for enrollment. Doctors need your participation. Well, we need the participation of doctors, but we need the participation of everybody in the trial. Dr. Mario Castro, the Vice Chair of Clinical and Translational Research here at KU, and Dr. Barbara Pahoud from Children's Mercy Hospital, one of their heads of research and a person who's been intimately involved with vaccination development across the country. They'll be back to answer questions about vaccine trials for adults and for kids. So that'll be a great program. We'll get a really good update for these two terrific folks on Monday. Final thoughts, team. It's been a year.
Yeah, it's been a year. Last year we didn't get the luxury of having a basketball tournament, so I'm really excited for this today, kicking off the.
She already asked me if I filled out my bracket.
Brackets are due at noon, so make sure you get those filled out and go Jayhawks.
I think before noon. Isn't 11:15 the first game?
Well,
The Jayhawks got robbed last year, so too bad we can't go to that. I was waiting until I know the final updates on any teams that test positive, so I'll fill mine out here just after this. But, we're going to be learning more and more information about the variants. We know that England has seen a reduction in cases since being able to get out vaccines into arms, jabs as they call it. So hopefully that will continue here, and we can continue to enroll people in our vaccinations, and all the local health departments and other facilities that are giving vaccinations, go out and get your vaccines. They are safe, they are effective, and this is the way we can stop the spread.
Happy birthday to you. Happy birthday to you. Happy birthday, dear MMU. Happy birthday to you. You know what? And happy birthday to all of us for having survived this year from COVID-19. And let's keep it going, right? Because we know that the rules of infection prevention and control travel with us wherever we go. Wash your hands, wear your masks, keep your distance. Don't go out if you're sick. Cough into your elbow. Take care of each other. And if we do that, and we all get vaccinated, we'll be the 2015 Royals bullpen. We will shut COVID down. We'll see you on Monday.